Welcome back to Eat Practical. Today is about magnesium supplementation and specifically how you can use it for certain health conditions. Magnesium is chronically deficient in a large part of the population. Around 48% of Americans do not get the recommended daily amounts, and that ties into a lot of different diseases, and that also means that supplementation can play a big part in addressing some of those diseases. Like other supplements, there's a lot of noise around magnesium, and there's not necessarily always a clear picture regarding what it can specifically be used for. And today's video is just going to address some of the specific conditions that it has backing in the research to have benefits for. So some of the specific conditions that there are good indications in the research to have benefit are high blood pressure or hypertension, diabetes, depression, and sleep issues. Moving specifically to blood pressure and blood sugar, blood pressure, there is a good amount of evidence that people that take magnesium on a regular basis actually see decreases in their blood pressure. Specifically, magnesium oxide, aspartate, chloride, and pyrrolidate showed the best effects in the studies, but more research is going to come out and there might be other forms that are effective as well. But those are just the ones that have been used the most in studies. And in terms of diabetes, magnesium has been shown to decrease the risk of developing type 2 diabetes, and that's fairly strong in the research. And then there's also some evidence that it can help manage blood sugar in diabetic patients, but the studies were more on pre-diabetic people. So it's especially useful to try and maintain magnesium levels if you're trying to avoid diabetes because of risk levels and risk factors. But there is definitely some benefit, or at least evidence of some benefit, for people that currently have type 2 diabetes, and it's definitely something you could talk with your care professional about. In terms of how it can help mental conditions, depression has the strongest evidence behind it in terms of magnesium producing some benefits, and they've done studies in regards to using magnesium, especially in conjunction with antidepressant medication, and it's shown general decreases in symptoms for depression. While with anxiety, they did show some benefits, but whenever they took out confounding variables regarding environmental factors and all that, there wasn't as strong of a noticeable benefit. So in terms of either one, it is just a tool in the toolbox. Like with any supplement, it's not going to magically make the problem better, but it is something that you could talk with your care provider with, or a dietitian, or consult someone who is a professional about if it could be a useful tool and what forms would be best to take for you specifically in your conditions, if there's any issues regarding medications you might be taking. It's just one tool in the toolbox. In terms of sleep, there is strong evidence with multiple different research articles that magnesium, especially when you take it close to your bedtime, is beneficial for improving sleep duration and sleep quality. And it is fairly easy to take at night because you can incorporate it into your nightly routine, and it has direct benefits, especially for people that do not get adequate magnesium, which has actually been shown for a lot of these conditions, is that the benefits are strongest for people that aren't getting it already through their diet. So thank you, everyone, for watching, and I hope that you tune in next time.